I not really feeling great for this video because it's talking about loneliness. Is it loneliness or is it isolation? No matter which label you use, loneliness or isolation, it's about the mental health of the pediatric caregiver, the mom. See, I think it's confusing a lot of times because we call mom at bedside, and we have all kinds of ideas about what mom does for her kid. But very often for mom herself or for anybody else, the concept of being a caregiver is a little off, strange, doesn't exist, not really thought about, because you're just supposed to do this very virtuous thing of taking care of your kid. The more you do that, and of course you're going to do that, but the more you go through systems, the more that you go through the development of life with a deteriorating illness, no matter what the lifespan is, to death, that development for even a parent is lonely. It's isolating. While you transition on your development through disease over time, you cannot function with the rest of the world with the ease that you used to. That's grief and loss. You are transitioning all the time to more homebound care. There's a whole group of parents that are existing at home with their kids, managing this long, very long, wonderful life with their children, but they are homebound. And I don't think people see that. I don't think that group of people get seen. And while they're having quality of life with their children, they're creating great experiences. I created great experiences for us here in our home. I know other families that do that. You just want to have the best experience with your kid. The burden of care, because of all the system fails or the fights, just compounds the loneliness. There are so few people that get it. Even the people in the systems, it's so partitioned off in separate places, silos, I guess, right? That leaves that individual on their own, fighting the fights, looking for help, services, coordinating care so that our security is there. But that's lonely. It's busy, but it's lonely. And it's, some of the trauma that occurs over time, from the first ICU visit to, massive surgeries, or like there's, just even, or for my case, it was a horrible experience at school with the school nurse, and that blew up all of our supports. It was horrible. And I was on my own. And yeah, it's lonely, and it causes trauma. The trauma does not end when the loneliness ends or when death comes. It continues on, and there's absolutely very few, little, if anything, services. Nobody talks about it throughout the lifespan in the hospital, with any social worker that you can possibly get. Very rarely is it addressed that you are living a lifestyle that has trauma. Your child has experienced trauma, but don't forget, you've experienced trauma alongside of them. And, this is a marathon. Our children are going to die before we do, and we need to survive that. And in order to do that, we need better mental health for pediatric caregiving parents. We need better supports and services for respite access. I mean, the list is long, but let's keep it to mental health today. Even just acknowledging that it is a very isolating path is something more than nothing. So I encourage you, if you're a service provider, get educated about what it means to be bedside mom, what it means to be a medical mom, what it means to access services. What does it mean? What's the lifestyle like? This is your client. You need to be aware of their needs to help, you know, support rather than rather than not. Anyway, it's a long road. I'm grateful that I've survived. I'm grateful that I'm here today to share my wisdom, to pass it on to somebody, anybody that is willing to listen. And I hope that you do the same also. There's another family up and coming. They've got a long path ahead of them, and the burden of care is with them. So the best that you can do is let them know that they are not alone in that. Walk with them, be beside them, help where you can, but don't let isolation take over their lives. Don't let that happen for them. Thanks. Thanks for listening. Take care.